I have one question to Fanchair and Margaret, please. So the question is, the Scottish Care Chief Executive, Donald McCaskill, has estimated that 30 to 40% of the country's residential adult care facilities may close permanently because of the immediate challenges they're faced. Would the projected £1.3 billion earmarked for the National Care Service, in your opinion, be better invested in local delivery of social care now?
That's a good question. You know, I think I said early on, I think the crisis is now, and if we want to retain a proper understanding of what kind of care is needed in Scotland, then I do think it needs to be invested in the near future. I fully understand the pressures on the overall budgets, but I think it's a choice, and it's one that we will need for a range of adults in it. I think one of the things, and again it might come in later, you know, without seeming over-optimistic, I think one of the things that we need to think more about is how you prevent crisis, because crisis is more expensive. And that's the piece that is consistently, including in the bill, I think not given enough attention. And it's not given enough attention because it's difficult, but everybody knows from their own family and their own circumstances, and certainly in our businesses, that if we can do more on prevention and early intervention, then it's what people want, and it actually saves the state money as well. And we've got evidence on that. But, you know, I think Donald may well be right that you lose quite a lot in the next couple of years while the National Care Service has been set up, and that's something we need to really juggle properly, I think.
I would agree with you there. I mean, I think for us as an organisation, the one thing that we are seeing a lot of stress on, and I think a lot of money could be invested better, prevents unpaid carers. Because obviously quite a lot of our work, we're going in and we're actually going into a household with two people in it, husband and wife, for example, you know, and you know, we're in to care for the husband and the wife's the main carer, you know, and there's a real lack of investment in giving people purposeful breaks at that point. So, you know, I think if we're kind of long term looking here, would I think the money would be better invested at this stage? I would totally agree. I'm a wee bit concerned the amount of money that's been spent on the National Care Service, where I actually do agree with it, but I think there is a crisis now about how we actually address our social care as a society in our communities. And, you know, I think, you know, as an organisation, and having been in health and social care for over 37 years, you know, I think I would agree with Neil, and probably this is the worst I've ever seen it. And I'm really concerned about if we wait 2 years and we wait for this to get pushed in, a lot could happen in 2 years. We will lose staff more. You know, I have real concern that there will be more crisis than we've ever had. And, you know, I think at the end of the day, the one thing that's missing a lot of the time, and I know Share Care Scotland to put that forward to yourselves, is the role of the unpaid carer at the moment. And that's going to put so much more pressure on them.